Donald Trump is back in the headlines, this time for his proposed budget for 2026. The proposal has sparked intense debate across the political spectrum. Trump's plan calls for a $1.7 trillion discretionary budget, a figure that has caught the attention of both supporters and critics alike. This represents a significant decrease in spending compared to previous years, marking a stark shift in fiscal policy. The most notable aspect of Trump's proposal is the $163 billion in cuts to non-defense programs, which has been a focal point of the controversy. This represents a 23% reduction in spending across various sectors, including education, healthcare, and social services. Trump argues that these cuts are necessary to reduce the size of the government and promote fiscal responsibility, a key tenet of his political philosophy. Trump's proposal has ignited a firestorm of controversy, with protests erupting in several major cities. Critics argue that the cuts will disproportionately impact vulnerable populations, including the elderly, low-income families, and those relying on public health services. Supporters of the budget cuts, however, maintain that they are essential for curbing government overreach and promoting economic growth, suggesting that a leaner government could lead to a more robust economy. The proposed budget would shrink domestic spending to its lowest level since the 1960s, a period known for its conservative fiscal policies. This has raised concerns about the potential impact on essential services and social programs, with many fearing that the cuts could lead to a decline in the quality of life for many Americans. The budget proposal is a clear indication of Trump's priorities, emphasizing a smaller government footprint and greater efficiency. As he seeks to reduce the role of government in various aspects of American life, the debate over the budget cuts continues to intensify. The cuts are likely to face stiff opposition from Democrats in Congress, who argue that the reductions are too severe and will harm essential services. This sets the stage for a contentious budget battle, with both sides preparing for a showdown. The proposed budget is a significant development in American politics, reflecting deep, ideological divides. Its impact will be felt for years to come, shaping the future of government spending and public services in the United States. While many areas face budget cuts, defense spending emerges as a clear winner in Trump's proposal. This decision reflects a strategic shift in national priorities, emphasizing the importance of military strength in an increasingly volatile global landscape. The budget allocates a staggering $1 trillion for defense, marking a significant 13% increase. This unprecedented boost is designed to ensure that the military remains well-funded and capable of addressing both current and future threats. This substantial investment underscores Trump's commitment to strengthening the military and bolstering national security. By prioritizing defense, the administration aims to project power and stability both domestically and internationally. The increased defense budget aims to enhance various aspects of the nation's military capabilities. This includes modernizing equipment, improving training programs, and investing in cutting-edge technology to maintain a competitive edge. A key area of focus within the defense budget is missile defense, with substantial funds allocated to bolstering the nation's ability to counter potential threats. This initiative is crucial for protecting the homeland from emerging missile technologies. Additionally, the budget prioritizes space dominance, potentially benefiting companies like SpaceX involved in space exploration and technology. This focus on space aims to secure the nation's interests beyond Earth and ensure technological superiority. The budget also includes a historic $175 billion for border security, reflecting Trump's continued emphasis on curbing illegal immigration. This allocation is intended to enhance border infrastructure and increase patrol capabilities. This allocation highlights Trump's commitment to securing the nation's borders and controlling immigration flow. By investing heavily in border security, the administration aims to address concerns about illegal immigration and enhance national safety. The increase in defense spending is likely to be met with mixed reactions. While some view it as a necessary step to ensure national security, others are concerned about the implications for other critical areas of public spending. Supporters argue that it is essential to maintain a strong military presence on the global stage and deter potential adversaries. They believe that a robust defense budget is crucial for maintaining peace and stability. Critics, however, express concerns about the allocation of such a significant portion of the budget to defense, especially in light of cuts to other essential programs. They argue that the funds could be better spent on healthcare, education, and social services. Education faces significant reductions in Trump's proposed budget, with a $12 billion cut representing a 15% decrease in funding. This move has sparked widespread debate about the potential consequences for students and the future of education in America. The cuts impact various levels of education, from K-12 to higher education institutions. One of the most significant areas affected by the education cuts is K-12 funding, excluding Title I schools serving low-income students. The budget proposal reduces funding for essential programs, potentially impacting classroom resources, teacher salaries, and extracurricular activities. Higher education institutions also face significant cuts, impacting work-study programs, financial aid opportunities, and services for immigrant students. The budget also proposes a reduction in funding for adult education and preschool development programs. Amid these cuts, however, the budget does include a $60 million increase for charter schools, signaling a shift in focus towards alternative education models. The proposed cuts to education have ignited a firestorm of criticism from educators, parents, and students alike. Opponents argue that these cuts will have a devastating impact on the quality of education and exacerbate existing inequalities in the education system. Healthcare spending faces significant reductions under Trump's proposed budget, raising concerns about the accessibility and affordability of healthcare for millions of Americans. The proposed cuts are seen as a significant shift in the government's approach to public health, potentially affecting a wide range of services and programs that many people depend on. One of the most drastic cuts targets the Centers for Disease Control and Prevention, with its budget slashed by half to $4 billion. This reduction is expected to severely impact the CDC's ability to respond to public health emergencies and conduct essential research. This reduction would eliminate funding for critical programs focused on chronic disease prevention, including efforts to combat heart disease, cancer, and diabetes. These diseases are among the leading causes of death in the United States, and cutting funding could reverse years of progress in managing and preventing them. Additionally, the budget proposes cuts to programs addressing public health challenges such as lead poisoning, smoking, reproductive health, and injuries. These programs have been instrumental in improving public health outcomes and reducing healthcare costs in the long term. These cuts have raised concerns about the potential resurgence of preventable diseases and a decline in public health outcomes. Public health experts warn that the cuts could lead to increased healthcare costs and poorer health outcomes for the population. The National Institutes of Health, a leading research institution, also faces substantial cuts under the proposed budget, with its funding reduced by nearly $18 billion. This could hinder groundbreaking research and delay the development of new treatments and cures for various diseases. The cuts would result in the elimination of 4 institutes dedicated to minority health, nursing research, global health, and integrative health. These institutes play a crucial role in addressing health disparities and advancing medical knowledge. These cuts have drawn sharp criticism from the scientific community, with experts warning about the potential setbacks in medical research and innovation. The loss of funding could slow down scientific progress and limit opportunities for new discoveries. Despite the significant cuts to public health programs, the budget does allocate $500 million for a new initiative dubbed Make America Healthy Again. However, the effectiveness of this initiative remains uncertain. Details about this initiative remain scarce, and it is unclear how effectively it can address the potential consequences of the proposed cuts to existing health programs. Critics argue that the initiative may not be sufficient to offset the negative impacts of the budget cuts. The proposed cuts to healthcare have drawn widespread condemnation from healthcare professionals, patient advocacy groups, and Democratic lawmakers. They argue that the cuts will disproportionately affect vulnerable populations and undermine the healthcare system. Opponents argue that the cuts will have a devastating impact on the health and well-being of millions of Americans, particularly those who rely on government-funded healthcare programs. The debate over the proposed budget cuts continues, with many calling for a re-evaluation of the priorities in healthcare funding.